Good afternoon. Welcome to the Donald I. Abrams Lectureship in Integrative Oncology. My name is Shelley Adler, and I have the pleasure of serving as the director for the UCSF Osher Center for Integrative Health. And today I have the great honor of introducing both Dr. Abrams and today's distinguished speaker, Dr. Weil. So to begin, the Donald I. Abrams Lectureship in Integrative Oncology, which is being inaugurated today, is an annual speaker series to share developments in integrative cancer care and research. Dr. Abrams is an integrative oncologist at the UCSF Osher Center, and he is now professor emeritus in the Department of Medicine. He is also much, much more. I will keep this short because the truth is that this inaugural lectureship could have just been talking about Dr. Abrams's accomplishments, but we do have a guest speaker. Let me just see. He, among many other things, was a really a pivotal figure in hematology and oncology at Zuckerberg San Francisco General Hospital. He's been president of the Society of Integrative Oncology, served on many, many different committees of the American Society of Clinical Oncology. He was one of the original clinician investigators to recognize many of the early AIDS-related conditions. And he's also conducted numerous clinical trials investigating both biomedical and complementary therapies in patients with HIV. He's looked at traditional Chinese medicine interventions, medicinal mushrooms, and medical cannabis. But Dr. Abrams' influence is far broader than this for all the folks who have the pleasure of knowing him, whether he's introducing people, including me, to the wonders of eclipse chasing, waxing poetic about his beloved dachshunds, or sharing what I'll call helpful hints about the nutritional quality of Osher Center snacks. Donald is truly devoted to improving the well-being of everybody around him. In a word, he is a true mensch. I guess that's 2 words. I really can't think of a more fitting way to honor this wonderful person than with the establishment of this annual lectureship. So to start us off, please join me in thanking Dr. Abrams for all of his contributions. Thank you. Thank you. And to know just how embarrassed you should be, Donald, there are several hundred people on the webinar as well. So lots of eyes on you. Now it's my pleasure to introduce today's speaker. Dr. Andrew Weil, who truly needs no introduction, is a world-renowned leader and pioneer in the field of integrative medicine. I was talking with him before this presentation about the fact that he completed his internship here at Mount Zion Hospital. He is the founder and director of the Andrew Weil Center for Integrative Medicine at the University of Arizona, where he also holds the Lovell-Jones Endowed Chair in Integrative Rheumatology, and is a clinical professor of medicine and professor of public health. I was also noting earlier that many of our clinicians, and certainly clinicians all around the world, have benefited from the outstanding training they've received through the clinical fellowship at the University of Arizona. Dr. Weil has authored 15 books, many of which are national and international bestsellers. Of particular relevance to today, he also co-edited with Dr. Abrams the Oxford University Press textbook on integrative oncology. Dr. Weil has been a friend of the Osher Centers for many, many years. He spoke at a symposium that was actually part of the initial celebration of the UCSF Osher Center in 1998. So let me note quickly that after Dr. Weil's presentation, we'll have about 15 minutes for discussion. And for now, please join me in welcoming Dr. Weil.
Thank you. Good afternoon, Donald. It is a pleasure to honor you with this lectureship. I first met Donald Abrams in 2002 at the Telluride Mushroom Festival, uh, a unique and wonderful event. And shortly afterwards, he enrolled in the fellowship at the University of Arizona and is one of our first graduates, one of our first oncology graduates. The demand for integrative oncology in our country is enormous, and the supply of practitioners trained to provide it is very small. And that's something that I think we all need to work on. About 10 years ago, I was in Beijing and I was taken on a tour of Guang'anmen Hospital, a very large hospital in the center of Beijing, which is entirely devoted to integrative medicine. And when you walk into this place, you'd think you were in one of our major hospitals in New York or San Francisco, a very modern facility. The largest department there is oncology. And I was presented a number of patients. Every cancer patient there gets chemotherapy, surgery, radiation as indicated, but in addition, gets very sophisticated nutritional therapy, acupuncture, massage, and especially very sophisticated botanical therapy, which is designed to reduce the toxicity and increase the efficacy of the conventional treatments to improve quality of life and reduce risk of recurrence. It made me very sad that so few patients in our country are able to access that kind of care. And of the patients who were presented to me, some were remarkable. One was a woman in her, I think she was nearly 80, who had metastatic lung cancer, and she had actually refused all conventional treatment and was only using the other treatments. She looked great. I mean, better than anyone that I've seen, in our country with that kind of condition. So I have sent a few of our oncology fellows over there to do rotations to see what they could learn. And also, I urged the people at that hospital to publish some of their best cases and make them available so that people here could read about them, since I think that whole world is unknown. I have to say, it infuriates me when I see institutions like Memorial Sloan Kettering taking out full page ads in the New Yorker advertising that they're providing integrative care. When I look at what they do, it's all the safe stuff. They're providing nutritional counseling, massage, yoga, stress reduction. They wouldn't go near a Chinese herb, you know, if it was on a 10-foot pole. People are scared of herbal products in general, and Chinese herbs in particular. My undergraduate training was in botany, and so I have a long career interest in medicinal plants. And let me just digress a bit and tell you some of my experience with them. When I was actively seeing patients, I estimate that for every prescription I wrote for a pharmaceutical drug, I gave out 40 recommendations for botanicals. And in the time that I did that, I did not see a single adverse reaction to any of the botanical remedies that I recommended. Do you know the extent of drug toxicity in our country from pharmaceuticals? I think most people have no idea. It's estimated that just in the hospitalized population in this country, there are between 2 and 400,000 deaths a year directly attributable to medication. And this is not mistakes. This is the right drug in the right dosage for the right indication and the right patient, and hundreds of thousands of people die. And that's just in the hospitalized population, and that's not looking at less than death events. You can count on the fingers of one hand deaths from herbal products. And almost always they are the result of some mistake that somehow a toxic plant has been mislabeled and sold as a useful plant. There was a much publicized case here in San Francisco some years ago of a woman who drank a Chinese herbal tea and died, and the tea had in it raw aconite. Aconite or monkshood is one of the most poisonous plants, but there's a traditional use in Chinese medicine of aconite roots, which are prepared in a way to make them non-toxic. So somehow this herbal tea had raw aconite in it, and there was one fatal result. This was front page news all over the country, and editorials in medical journals saying this is what happens when people, ignore the advice of physicians and pharmacists and go on their own. to health food stores and buy these kinds of products. I mean, that is just so hypocritical. There's no comparison. Uh, some, some I just consistently hear from conventional doctors and pharmacologists and pharmacists that natural products are dangerous because we don't understand them. They're complex. We would rather work with single compounds. Um, the Long ago, I think this probably in the 1970s, when I was first learning about traditional Chinese medicine, it struck me that mushrooms were so prominent in the formularies of Chinese medicine, and they had been completely ignored in Western medicine. We're inclined to think of mushrooms as being worthless or toxic, and they've never been looked at as sources of medicines. And that's strange, seems strange to me, because first of all, mushrooms have very unusual chemistry. They have molecules that aren't found elsewhere in nature. So that would be a promising place to look for, new agents. Secondly, a lot of mushrooms are toxic to one degree or another. And there's really no difference between a drug and a poison except dose. Many drugs become toxic in high enough dose, and some poisons become useful medications in low enough dose. So if you want to find new medications, one place to look is an area of nature where there's a lot of toxicity. And then on top of that, the greatest success of pharmacotherapeutics in the past 100 years has been the discovery of antibiotics from very closely related organisms. So for all those reasons, you would think people would have looked to mushrooms as sources of new medicines, but they haven't. And in traditional Chinese medicine, mushrooms are used for all sorts of things, but one of their main indications is what are now called adaptogens, that is, non-toxic products that make the body more resilient and more resistant to stress of all kinds. And a lot of them were indicated for cancer and other chronic conditions. So that fascinated me, and I began traveling to Japan and to China. I met with researchers who were studying these mushrooms. I learned a lot of interesting stuff. One was that, the little enoki mushrooms, the skinny white ones that are available in our market, they're mostly grown in one area of Japan, in the Gano prefecture. And a researcher there found that within a 50-mile radius of the city of Nagano, which is the center of this cultivation of this mushroom, there were significantly lower cancer rates than in the rest of Japan. And he attributed this to high consumption of these mushrooms on a daily basis by growers and their families. And this led to the isolation of a compound, that had protective effects against many kinds of cancer. So I began trying to teach people about this and make people aware of the importance of medicinal mushrooms. And I'm happy to say that after a very long time, there has been a great uptick in research. There has been a lot of it going on in Asia, but there has finally begun to be research in this country as well. I think the great advantage of these medicinal mushrooms, the ones that are used for cancer treatment, they are completely non-toxic, no adverse effects, and they work apparently in ways that we have nothing comparable for in Western medicine. They modulate immune function. Now, Donald and I have a little disagreement. Donald is worried that if we use these in certain kinds of cancers and lymphoproliferative cancers, they may be contraindicated because they upregulate immunity. I don't think they actually upregulate immunity. I don't think they increase the potential for allergy or inflammation. I think they modulate immune function in a way that I think is perfectly safe. So I think these are okay in all kinds of cancer, but we don't have research on this, and I encourage us to try to get a definitive answer to that. I think these are quite safe. And a general piece of advice is that we should all be eating more mushrooms. It's also interesting that in traditional Chinese medicine, there's really no distinction between medicines and foods. There are many ingredients in Chinese cuisine that are there for their perceived medicinal effects as much for their flavors or texture. For instance, wood ear mushrooms, which are the crunchy ones that really have no taste, have a significant anticoagulant effect. And can be used. Some people are able to use this in place of our conventional blood thinning drugs. And this is a traditional use in Chinese medicine. They have been considered, that they've been useful for the health of the blood. red yeast rice, which is a natural source of statins, as I think many of you are aware, is a natural product that works for many people as well as pharmaceutical statins with a far lower chance of adverse effects. I think the reason for that is, and this goes, I could talk endlessly about this, is the difference between complex natural products and isolated compounds. I think, that statins, I think, are generally quite safe and effective for the way that they're used, but for some people, they cause muscle pain, they distort liver function. And I think when you give the red rice yeast, you're less likely to see that because you're presenting the body with 7 different monocolins, which are these molecules. And so it's like a suite of molecules that are like each other, but slightly different. And I think that sort of prevents the body from mounting a counteractive response to getting a single molecule. And that's a general pattern I see with using complex natural products versus isolated compounds. But that's another fungal product that, traditionally has been used in Chinese cuisine, both to add a red pigment to foods, as well as to help combat obesity, for example. Now, I could talk before I talk about other aspects of integrative oncology, or actually, no, this is a central aspect of it. Integrative medicine in general, one of our aims is to try to shift the whole enterprise of our collapsing healthcare system away from disease management toward health promotion and prevention. And I think, we have to ask ourselves a very hard question as a society: why don't we do a better job at health promotion and prevention? And I'm afraid that has a very simple answer: they don't pay. And until we can figure out how to make prevention and health promotion pay, we're not going to get anywhere. And the other fact is that the diseases that we're trying to manage are mostly lifestyle related diseases that could be prevented if people early enough made better choices about how to eat, how to be active, how to handle stress, and so forth. And again, we have to ask ourselves, why can't we do a better job at that? The other just sad reality is that as dysfunctional as our healthcare system is, and I think it's getting more dysfunctional by the day, it is generating rivers of money that are flowing into very few pockets. It's the pockets of the big pharmaceutical companies, the manufacturers of medical devices, the for-profit healthcare systems, and other institutions. And these vested interests want nothing to change. They also have total control of our elected representatives. Does not matter whether you're Democrat, Republican, liberal, conservative, you can't get elected to office in this country unless you have made deals with those vested interests. And I don't see any way that that's going to change unless there is a grassroots social political movement in which we begin electing different kinds of representatives who are not beholden to those vested interests. And I don't see that happening yet. I don't know what it'll take for people to get angry enough, to begin working against this current system. And doctors are as much a victim of it as patients are. When I went into medicine, it looked like a very attractive profession. And one of the reasons was that it promised you autonomy. You could be your own boss. That's going completely out the window. You are now told how many patients you have to see an hour, and you're told what treatments you can prescribe and which you can't. And this is all part of this, system that so many of us are victims of. When I look at cancer, the efforts we put toward prevention, I think, are slight compared to the efforts we put toward treatment. And since treatment of cancer is difficult, especially many kinds of cancer, I think it's especially important to focus on prevention. We know a lot about preventable causes of cancer. And what are we doing about them? Donald just sent me an article about the percentage. What was the estimate, Donald, the percentage of cancer that 50% is preventable? A leading cause is smoking, which continues to be. And our attitudes towards smoking, I find this very interesting. In the early part of the 20th century, when there began to be an epidemic of lung cancer, for many years, the medical profession said the cause was air pollution and ignored what was right in front of their faces, of people, doing this habit. When I was in medical school, in the late 1960s, first of all the pulmonologists at the University of Arizona smoked. And, and secondly, I was taught nothing about smoking as an addiction. It was a habit, and therefore it wasn't worthy of attention the way that heroin addiction was. I started lecturing to first and second year medical students in the 1970s, 1980s, and I proposed giving a 1-hour lecture on tobacco addiction and strategies for managing it. It took 3 years to get permission to give that lecture because nobody would give up an hour. Here is the single greatest cause of preventable serious medical disease, and it wasn't taken seriously. And when I look around today, I think we've changed the demographics of smoking, but I'm not so sure we've done much about the total number of people who are caught up in that addiction. And I am also disturbed at the amount of smoking I see in movies and in TV series. It seems to be greater than ever. And that is a tremendous inducement for young people to begin that habit. By the way, the one statistic that I thought is just astounding is that a young person who smokes more than one cigarette has only a 15% chance of remaining a non-smoker. That drug taken by that delivery method is right up there with crack cocaine. It's more addictive than heroin, and that's a consequence both of the pharmacological power of nicotine and the manner of delivering it to the brain. And so I think we have a lot of progress to go there. Another, I think, second on the scale of preventable causes was obesity and excess weight. And that is a very complicated one. And I'll just want to give you some thoughts about that. The obesity epidemic in this country, which is dramatic. A few years ago, a book came out that tried to argue that the obesity epidemic was an artifact of the way we're measuring people. That's nonsense. All you have to do is look at movies from the 1940s and 1950s, documentaries with the huge crowd scenes. You don't see a single fat person. We have changed phenotypically dramatically. And what's causing that? I don't think it's just a matter of people overeating and under exercising. Something else is going on there. And I think it has to do with the way we've changed food. Michael Pollan wrote that our great grandparents would not even recognize as food what most people eat today. And it's not obvious stuff. There was a book that I recommend to you called The Dorito Effect that came out several years ago by a medical journalist. And it began by saying that if you talk to people in their 80s, 90s, about what food was like when they were growing up, that people say that it tasted much better. The chicken tasted better, vegetables tasted better, fruits tasted better. So we have, in our agricultural practices, we've selected for varieties that resist shipping, that are shelf stable at the expense of flavor. And in response to that, a multi-billion-dollar industry has grown up in flavorings, which is dominated by, I think, 6 companies around the world, 3 in the US, 1 in the UK, 1 in Japan. They manufacture thousands of chemicals. Some of these are natural, some are synthetic, some are semi-synthetic. They are in all of our food, sometimes dozens in any one product, and they're concealed under the label flavorings. The FDA doesn't regulate them. They are not required to be put on the label. We have no idea what these things do to us individually or in combination. And I suspect that that's one of the things that's driving the changes that we're seeing. And we know very little about that. One category of food additives that I've been focused on recently is gums and products like guar gum, xanthan gum, maltodextrin, which are used as emulsifiers or thickeners in many, many food products. These are all called, generally recognized as safe by the FDA, but there is reason to think that they cause inflammation throughout the body, particularly in the gut. And one of the kinds of cancers that we're seeing increasing is colorectal cancer, especially in young people. And I think anything that promotes inflammation in the gut, to me is suspect for being potentially carcinogenic. So that's just one category of these things that are out there. But this is my guess, is that there's something about the way we have changed food that is driving this obesity epidemic. And by the way, those of you, clinicians, I think that our attitudes toward obesity in this culture have really warped medical judgment. I don't think it is necessarily unhealthy to have excess weight. And there are many people out there who cannot lose weight no matter what they do. And I think the best advice you can give them is to stay fit. It is much better to be fit and fat than to be thin and unfit. No question about that. So I think that that is, a very practical piece of advice. But I also feel very strongly that the more we distort food from the way nature produces it, the more likely we are to reduce its nutritive qualities and increase its dangerous qualities. And I think that that's something that really has happened here. So, I am delighted that there is a Society for Integrative Oncology, that there is a textbook of integrative oncology, that there is a demand for integrative oncology. I think we have a long way to go. And I also feel that, I gave a lecture at the University of Arizona a few years ago called "What Were We Thinking?" Looking back at really awful medical mistakes that we've made. And, just like, well, I'll tell you one. When I was growing up, shoe stores had fluoroscopes in them to check the fit of shoes. So there was this big console, and as a kid, you had a new pair of shoes, and the shoe salesman took you over, put your feet under, looked in. There was a glowing green screen in which you saw the bones of your feet in the shoes, and they'd show your parents. And as a kid, the game was to distract everybody so you could stay under it as long as possible. I mean, unbelievable fluoroscopes in shoe stores. What were we thinking? Go back a little further. I found at Harvard Medical School, there was an attic that had a museum of medical curiosities. And one of them was a belt to be worn around the waist for 2 hours a day with two pouches that fit over the kidneys that were filled with radium ore. And this was designed to deliver healthful radiation to your kidneys. But there are so many things like this. Here's one that many people don't remember that nobody should be allowed to forget. Well, first of all, when I was growing up, it was impossible to make it to adolescence with your tonsils and adenoids. They were considered useless organs, vestigial organs, and somehow that gave doctors permission to take them out, at the drop of the hat. We now know these are important parts of the immune system that are there to guard against infection coming in by the oral route. Same thing with the appendix. There are many, many people who went into the hospital for abdominal surgery, things like hysterectomies or gallbladder removals, who did not find out until they got their hospital bill that their appendix had also been taken out as a preventive measure because it could cause trouble and had no function. And it's also filled with lymphoid tissue, and it's there to guard against infection coming in at that end of the GI tract. But worse than all this was what we did to the thymus gland. When I was in medical school, I was taught that the thymus had no function. It was a vestigial organ. It's really interesting. Here we don't understand the function of an organ, so we say that it's functionless. The thymus is very active in childhood and adolescence when it's training lymphocytes to recognize antigens for the rest of your life. And somewhere in adolescence, it begins to shrink. That was called the involution of the thymus. And somehow that was taken to mean that it had no function. I don't follow that logic, but that's what doctors said. So in the 1950s, doctors at leading medical centers invented a disease that every child had called thymic hypertrophy, meaning the thymus is too large, which was treatable by bombarding it with X-rays. The thymus has quickly dividing cells, so it's very susceptible to radiation, and you shoot X-rays at it and it shrinks up right away. So parents were persuaded to bring their kids in for weekly treatments. I don't remember for how long. And I found out about this because a college roommate of mine, who was then clerking for a Supreme Court judge, got a letter out of the blue from Michael Reese Hospital, leading hospital in Chicago, saying, according to our records, in so-and-so such a date, you were given a course of X-rays to deliver to your thymus, and we're now finding that people who had this treatment have a higher incidence of thyroid cancer, and they urged him to come in for a checkup. How would you feel if you suddenly got, such a letter? But what I don't know what even to say about this. I mean, what chutzpah to say that you don't understand what this organ does. So let's do something horrible to it to make it shrink. And I think there's also an interesting contrast with Chinese medical philosophy, that the Chinese did not understand the internal anatomy. They didn't do autopsies, but they had a very clear and they didn't understand what the immune system was in terms of organs, but they understood that the body had a defensive sphere of function. And they searched the natural world to find things that would enhance or protect that function. And that's where these mushrooms fall into. They are in this category of natural products that enhance the body's defensiveness. And I think that is a great contrast to the way we treated these organs that we didn't understand. I have to say, when I look at these kinds of medical blunders, and I could go on about them, it makes me think, what are we doing now that 20 years from now, 50 years from now, we'll look back on with that same sense of, astonishment and horror that we do with these things that I've mentioned. And I have a feeling that chemotherapy and radiation are going to be in that category. These treatments are very crude. The rationale for them is that they kill dividing cells. And the assumption is that cancer cells are dividing faster than normal cells. That is true for some kinds of cancers, and those are the ones that we can treat successfully. But for many kinds of cancers, the cell division rate is not as high as that of normal tissues, especially to the skin, the lining of the GI tract, and most importantly, the immune system. So you can afford to have your hair fall out and GI upsets, but you don't want damage to your immune system, which might be your long-term hope, for a permanent remission or cure. So to my mind, I think these treatments will be replaced. And, I think they'll be replaced by targeted gene therapies, by, variety of other things on the horizon. And that one day, I hope sooner rather than later, we'll look back on these with the same sort of feeling we have about looking at fluoroscopes in shoe stores. So let me repeat that the demand for integrative oncology is enormous. And that model that I saw at that hospital in Beijing was very encouraging. And I think that kind of care could be provided easily here by people who were trained in how to use it. And it's not a matter of rejecting conventional therapy. And this is true of integrative medicine in general. We're not trying to replace conventional medicine. We're trying to make it better. We're trying to add to it. And in our center, in our fellowship and other educational trainings, we're trying to remedy all the deficiencies in subject matter that should be taught to physicians but aren't, starting with nutrition, for example. In my 4 years at Harvard Medical School, the total instruction that I got in nutrition was 30 minutes, which were grudgingly allowed to a dietitian at one hospital I worked at in Boston to tell us about special diets we could order for patients. I don't think that's changed a whole lot since I've been out of medical school. When nutrition is taught now, it's taught as biochemistry, and it's forgotten as soon as the biochemistry exams are over. And one consequence of that is that doctors are really unable to act as a counteractive lobby to industry pressures. For example, the USDA dietary pyramid was revised a few years ago, and the dairy industry got the recommended servings of dairy increased from 3 to 4 a day. Not one member of the medical profession testified in Congress against that. The last I checked, 48% of US hospitals have fast food restaurants on their premises. I mean, what example are we setting for our patients? And here's another cautionary tale I will tell you, which points up what I said at the beginning about how the vested interests out there, are blocking any kind of change. I got a letter a few years ago from a first-year student at the University of Pennsylvania who had started a campaign to get a McDonald's out of the university hospital. He got a petition going among his fellow students. They got publicity in the Philadelphia papers. And he was called in by the dean of students, who told him that if he persisted in this, he would jeopardize his medical degree. That's the problem. The university, the hospital had signed a deal with the devil. It was money, and this was a threat to it. And this is the kind of thing I mean. Whenever you look for how we change things, you run up against, these powerful kinds of vested interests. And I'll just say again that the only way I see this changing is if there is a grassroots social political movement in this country, and we begin voting in different kinds of representatives. So let me leave you with that message, and I would like to continue by answering any questions you have. Thank you.
Thank you so much. I will ask folks to raise their hands if they have questions. We'll do some from the audience first here, and then also if there are questions for people online, we'll do that as well.
Oh, Dr. Weil,
Yes.
Great to have you here. Seems to be this rising promotion of hardcore carnivore diets of no vegetables, no grains, just meat. And people are saying, oh, this is therapeutic. And I'm like, you're crazy.
Yeah, they're not only saying that, they're saying, I hear them say that vegetables are toxic, that they have lectins in them and oxalates. Also, I've heard them say that cultivating vegetables is more damaging to the planet than cultivating meat. I mean, what nonsense. I think it is very clear. I don't tell people not to eat meat, but I think cutting down on the percentage of meat in the diet is a very, very healthy strategy. I think these carnivore diets are ridiculous. How many of you have followed the Liver King before he had a fall from grace? This is a guy who's like an incredible muscle-bound guy who only ate meat and a lot of raw organ meat. He got busted. It turned out that he was using a lot of steroids too. But the pictures of him are just amazing. Anyway, that's pretty dumb. And then there's there's so much dietary nonsense out there. The advice, my dietary advice can be put in one sentence, which is to stop eating refined, processed, and manufactured food. I mean, that is the single most important thing you can tell people to do. That's what's doing us in. That's what fills our supermarkets today. I look at the extreme keto and paleo people. They tell people not to eat beans. Beans are very good food. They have a lot of fiber, they have protein, they have slow digesting carbohydrate, they have minerals, and most of all, they are cheap. One of the arguments that I hear a lot is, well, integrative medicine is only for the affluent. If you want to eat healthy, you have to shop at Whole Foods. Not so. And beans are a perfect example of, one of the healthiest foods. And here is a whole group of people telling people that don't eat them, that they're not healthy for you. So the dietary nonsense out there is just crazy.
Similar to that question, what about fasting? What's your feeling?
Well, I'm not an expert on that. I think first of all, there's different kinds of fasting. One is just short-term. First, to me, fasting means nothing but water. And short-term fasting is like up to a day. And I think that can be a very valuable strategy if you're coming down with a cold or some infectious illness to stop eating. That's what animals do. It frees up energy that the immune system can use. That makes sense to me. Then there's long-term fasting, which can be up to several months. And there is very interesting research. I mean, this is not easy to do and probably needs to be done under supervision, but there is very good research showing that long-term fasting can cause dramatic, complete remissions of rheumatoid arthritis, of asthma, of ulcerative colitis. The problem is that when people go back to eating food, often these conditions come back, but you can find ways of transitioning people to a vegan diet, and then maybe adding other things to it and maintaining the improvement. Then there's intermittent fasting, which has gotten so much publicity lately. And I think I'm not an expert on that. I see research go back and forth. There's all different schedules that people follow, which makes it hard to, understand. I've tried, it doesn't work for me. I get ravenously hungry if I don't, eat in the morning. But, for some people, it seems to work. It may improve insulin sensitivity. I don't think we know enough about it yet.
I was going to say, if folks want to maybe say your name also and role, for example.
Hi, my name is Krista. I'm a predoctoral trim fellow at the Osher Center. I just wanted to ask, when you visited China and Asia and learned from oncologists there, did you catch any vibe on what they think of how we operate in America with oncology? Like what they think of our system? What are their perspectives?
Well, I think that confounding for them is the expense of our system, since they just don't have those resources. So they can't provide that kind of expensive care that depends on expensive technology. So I think that cancer patients, outside of that hospital I mentioned, a lot of them don't get the quality of care that people would get here. Beyond that, I don't know what to say. I think there are, the incidence of cancer there is high, and I think there's differences in the kinds of cancer that are more common there than here. There's still an awful lot of smoking in China. There's, a lot of the foods that are eaten there are no longer as healthy as they probably were traditionally. So I can't say more than that. I didn't get a chance to see enough of it.
Hi, my name is Lena. I'm a naturopathic doctor and I'm a postdoctoral fellow at the Osher Center. I just have a question about your thoughts on some of the more invasive natural treatments in oncology, like high-dose vitamin C, artemisinin, curcumin, mistletoe, that whole realm in IV format, injection format, and where you stand on that.
I'd like to hear what Donald has to say about that. First of all, I am uneasy when people are injecting themselves with things. I often say I think we're born without direct access to our veins for good reason. I was just staying at a fancy hotel in New York, and they had a butler for individuals, and she came into my room and she's telling me about their services, and she said, we offer IV therapy. I mean, a hotel offering IV therapy? As for the, Donald, would you say something about IV artemisinin or curcumin?
Yeah, no, I agree with you. I wouldn't go there. Even intravenous high dose vitamin C, I've never seen it really be
right.
of great benefit. What about coffee?
There was an alternative cancer therapy called the Gerson therapy, which for a time had, a following. It was finally, I think, driven out of the U.S. to a clinic in Tijuana, and it had some, there was some useful nutritional advice as part of that. It was focused on detoxifying, and one of the things that was recommended was coffee enemas, which were supposed to stimulate the liver to excrete toxins. And one of the arguments was that coffee by that route was not stimulating, which is nonsense. It's much better absorbed, that way, because there's more blood vessels there. So I thought this was long dead and gone, but my daughter, who runs my social media, I stay off of social media entirely, but she, posts all the stuff on there, and periodically asks me questions to answer, and tells me some about the responses, which mostly I don't want to know about. But she said that one that provoked the most angry deluge of comments was I trashed coffee enemas. I said, there's no reason to do them. Unbelievable numbers of people got angry with me for saying that. So I don't get it. Another one that I worry about is ozone therapy. Ozone is a very powerful oxidant. And if you buy the whole antioxidant, theory, why would you want to put strong oxidants in your system? And especially, people that are doing this intravenously, that seems potentially dangerous to me. And rectally, right, with coffee.
Let me ask a question from the webinar that's going back to oral route, if that's okay with folks. Here's a question. Recently, the New York Times reports that any amount of alcohol is toxic. Do you agree that we should now avoid any alcoholic?
It is interesting to look at this historically and see how the pendulum has swung back and forth about alcohol over the past 50 years. We're told that it's beneficial, that it increases heart health. Red wine is good for you. Drink a glass of red wine every day. Then it's not good for you. Now we're in this phase where any amount of alcohol is not good for you. I don't take an extreme position here. I think the main advice that I give people about alcohol is that if you're going to drink it, don't drink it every day. You know, you want to emphasize moderation with it. And there are probably some people who should be especially cautious about it. Donald, what about women with some forms of breast cancer? Would you advise them to avoid alcohol?
Linear relationship between glasses of alcohol consumed and risk of postmenopausal estrogen receptor positive breast cancer. The American Institute for Cancer Research changed the guidelines now about alcohol. They used to say, if consumed at all, limit to 2 a day for men and 1 a day for women, which was difficult as somebody who doesn't drink to sort of
that seems a lot. And I would add to that, don't drink every day.
Well, so now in 2018, it says for cancer prevention, it's best not to drink alcohol. Again, 6% of all cancer is felt to be related to alcohol.
So, the benefits of alcohol is a relaxant. And for many people in our culture, it is their primary way to relax. And the benefits of relaxation and stress reduction may override any negative effects of it. It may have a beneficial effect on the cardiovascular system directly. On the other side, it is definitely toxic to the liver, and it's definitely toxic to the nervous system. So I think those things have to be balanced out. I don't know what the answer is. I would go. Thank you. Yes.
I think, in Science Magazine, a report that the NIH had discontinued research into the possible benefits of alcohol because the researchers had been bought off to an extent by the alcohol industry to produce beneficial.
It is so hard to know what, in this kind of muddle, what's right and what's not. And I just come back to, if you're going to drink, moderation.
Okay, great. And then we're going to go back to the mic just so people can hear.
I love the conversation about medicinal mushrooms. What I find, because I recommend them to most of my cancer patients, is that as soon as a patient's liver functions elevate, the oncologist demands that they stop their medicinal mushrooms. And I say, hello, that never is the cause. It's the chemotherapy.
Right. And, we have a wonderful botanical for protection of liver function, which is milk thistle. And that should be anybody receiving a potentially liver toxic drug should be on milk thistle. And that's one, that you hear this reflexive, oh, it's dangerous to take any botanical product. Another one like that is astragalus, a Chinese herb that's been used for centuries to ward off colds and flus, completely non-toxic, and has a protective effect on bone marrow. And I think can be taken with, by cancer patients who are receiving any kinds of chemotherapy agent or radiotherapy that may damage bone marrow. And these are things that should be used routinely as part of integrative oncology.
I can't see who has the mic. So, okay, thank you.
Hi, my name is Ava Zhao. I'm working on a breast cancer education at the Osher Center. And so I wanted to bring the topic back to diet and nutrition. Specifically, I was struggling between picking the falafel outside versus the chicken skewers. And I wanted to get your opinion on what are your thoughts on meat in general? Because in traditional Chinese medicine, meat is incorporated as having medicinal nutrition. However, I've been reading recently, How Not to Die, I think by Michael Greger, and he advocates a vegetarian diet. So I'm curious what your thoughts are.
Well, I'm a pescatarian, so I haven't eaten meat in a long time, but I do eat fish. I think one of the best changes that Americans can make in their diet is to eat less meat. I won't say no meat, but to eat less and to replace some of the animal protein in general with plant protein. I'm a big fan of soy and soy protein, and that's another one where, it's interesting to see the division of opinion there. There has been so much anti-soy propaganda in the press and on the internet. I think some of that is neophobia and xenophobia. Soy was a foreign food that was suddenly introduced to this culture not that long ago. So I think some of the reactions to that, some of it I think is coming from the meat and dairy industries. Some years ago, I saw an enormous tanker truck going through the streets of Manhattan that labeled silk. So if it's gotten to that point, surely the dairy industry has taken notice, and some of this stuff is coming out. I've read articles saying that milk causes homosexuality, causes breasts to develop in young boys and so forth. I mean, nonsense. And the other kinds of arguments come, I think, from people who don't understand the nature of complex botanicals. Soy has 4 isoflavones in it. These are estrogen-like compounds. If you isolate these and put them in test tubes with cultures of breast cancer cells, 2 of them stimulate growth and 2 of them inhibit growth. So the fact that there are elements there that stimulate the growth of breast cancer cells leads some people to say that soy is cancer promoting and should be avoided. But that does not take account, what does the body do when it's given a mixture of things that have opposite effects, that have a push-pull effect? I think the body decides what to use, and that probably has to do with which receptors are available for binding. The epidemiological evidence is overwhelming that soy is protective, that it protects against prostate cancer in men and breast cancer in women. And I think the earlier in life that it's introduced, the greater the protective effect. And so I hope that answers your question. I think less meat and some vegetable protein in place of it.
Hi, my name is Fatima Berrigan. I'm a pediatrician here at the Osher Center and a previous alumni of your integrative medicine program. I have a 2-tier question. Number one, I agree with you. I think there needs to be a grassroots program that is started so that we can all join together. And I think also it should come from someone of your stature to allow us to join, because if it starts for someone like me to start it, then there may not be as much of a pool to bring it forward. So if that is of interest to you,
yes,
that's the first point. And then the second part, I think these things like what were we thinking, right? As a pediatrician, I focus a lot on preventive medicine. And I think processed foods is a big thing for children. And I worry a lot based on the access different types of children have to different types of foods, when even things that are offered through WIC or food stamps programs or whatever they are based on what state are, a lot of it is processed. And so what advice would you give a pediatrician?
Again, whenever you try to attack things like this, you run up against the same issues. The people eat what's cheap and what's available. We have made the unhealthiest food cheapest and most available. One way we've done that is through federal subsidies of commodity crops that have made products like high fructose corn syrup and refined soybean oil so cheap that they're ubiquitous in processed food. We don't subsidize fruits and vegetables. You try to change this and you run up against those vested interests again. But that's the kind of thing that has to change. The density of fast food restaurants is much higher in poor neighborhoods than it is in other neighborhoods. The way we advertise processed and refined foods is very appealing to kids. You look at kids going down the aisles of a supermarket, and looking at all the brightly colored cereals and things like that. And we just have a long way to go. But I think that's an essential problem, is how do we change the nature of food and make healthy food more available to people.
Well, let me know when you want to start that.
I will. I'm ready.
And we have a few comments actually on online about any advice on getting started advocating for a political change. So maybe we'll begin.
Yeah, every graduating class of fellows, I tell them, my hope is that you can help catalyze this movement, by starting to talk to your patients about it, by talk to your colleagues. There are several groups around the country that are working in this direction. And one of the things I'm trying to do is to coordinate these and get some kind of communication. So keep in touch with our center at the University of Arizona. This is like high on my agenda of things we have to do.
Thank you. And I think this will likely be our last question for now.
Hi there. My name is Sarah Patterson. I'm a rheumatologist and a researcher here at the Osher Center. I really appreciated the comment about the importance of being like that it's preferable to be fat and fit over thin and unfit. And, you know, I think as a physician, I've noticed that there's so much emphasis in clinical practice on the number on the scale and what the BMI is. And in our EHR, it always says what the BMI is, you know, in the top right-hand corner. How do you think we can operationalize in clinical practice and for the transition to more of an emphasis on body composition and being fit? Like, how do we define that for folks and kind of move that focus toward being strong?
Yes, well, it's like, I mean, you want to assess what a person's level of physical activity is and, you know, make recommendations to them. I think the mind-body component is very important. Helping people feel better about body image is very important. You know, teaching people to eat healthier food, of course. But, you know, there are an awful lot of people out there that no matter what they do, they can't take weight off. So you want to tell them that, you know, okay, then you want to put a lot of effort into keeping yourself as healthy as possible by the nature of your physical activity, by the things that you do, you know, your mental states and all of that. We have a ways to go.
Perhaps by the next time we see you here, we'll have solved these. I want to thank you so much, Dr. Weil. And again, thank you, Donald, for all of your work. And hope to see you very soon.
Good.